Hey there, everyone. Today, we are diving into a truly eye-opening topic that sheds light on the desperate situation in Yemen. The country's crumbling healthcare system has left millions of people with no choice but to turn to alternative medicines, and is a story that deserves our attention and analysis. Now, imagine growing up in a village where modern healthcare is a distant dream. That's the reality for Jalila Abdul Hamid, a woman in her 50s, who witnessed her mother's untimely death due to a lack of proper medical care. It's a stark reminder of the challenges faced by Yemenis, where herbal medicine has become a last resort for many. Jalila's story is a tragic one. Misdiagnosed with a colon ailment, she was prescribed the wrong medication for months, only to be told later that she had liver cancer. With complex cancer cases being nearly impossible to manage in Yemen, she was advised to seek treatment abroad, an option out of reach for most. This is where the story takes an interesting turn. Desperate for a solution, Jalila turned to herbal remedies, encouraged by local health stores. But what seemed like a promising alternative led to a severe deterioration of her health. It's a cautionary tale that highlights the risks and misunderstandings surrounding alternative medicines. Now, here's where it gets even more intriguing. While Jalila's experience was unfortunate, it's not an isolated case. Rakib Sultan, suffering from stomach pain, found relief in herbal medicine after conventional treatments failed. His positive experience raises questions about the potential of alternative remedies, especially in a country where access to proper healthcare is limited. But hold on, there's a catch. Medical experts strongly dispute the claims of herbal practitioners, arguing that many patients end up back in hospitals, often in worse condition. It's a battle between traditional wisdom and modern medicine, and it's one that Yemenis are caught in the middle of. Dr. Adel, an internal medicine specialist, sheds light on the dangers of relying solely on herbal remedies. He emphasizes the need for qualified doctors to prescribe proper treatments, especially for infections like H. pylori, which can have fluctuating symptoms. It's a reminder that, in the 21st century, we should not be bypassing hospitals for unproven methods. Herbal medicine stores are everywhere in Yemen, and for many, it's become a lucrative business. Practitioners claim to cure everything from headaches to cancer, often basing their practices on Islamic teachings. But here's the thing, while some patients report positive outcomes, the lack of formal medical training among these practitioners is a cause for concern. Oli, a herbal medicine practitioner, believes in the power of his remedies and accuses some doctors of trying to tarnish their reputation. He argues for collaboration between alternative medicine practitioners and doctors, a perspective that adds another layer to this complex issue. The absence of official permits and oversight is a major concern, as it leaves patients vulnerable to potential exploitation. Jalila, still battling cancer, emphasizes the need for regulation, arguing that these herbal centers directly impact people's health and should be held accountable. In conclusion, the situation in Yemen is a stark reminder of the importance of accessible and effective healthcare. While alternative medicines may offer hope, they also come with risks and uncertainties. It's a delicate balance, and one that requires careful consideration and regulation. So, what are your thoughts on this? Do you think alternative medicines can ever truly replace modern healthcare? Let's keep the conversation going in the comments. Until next time, stay curious and keep exploring the world around us.